When COVID-19 entered our community, it was actually pretty early in the recognition of COVID-19. Seeing all the departments come together to work on an initiative and to keep the organization going every day has been key.
I think the only thing that prepared us is we had a team in place that could be there 24/7 in any of the nursing homes or see people at home. So in that sense, the teamwork, the framework was there, so that helped us. And having the ability to work with the hospitals, the nursing home systems, especially the infectious disease department here, labs, x-rays, I think that's what stood us in good stead.
COVID-19 drastically changed the way we care for patients and our day-to-day work. In nursing, we pride ourselves on basing decisions on evidence. And with little or no evidence, it was difficult to be able to know how to care for these patients properly.
The frontline workers in the COVID pandemic, they're the heart of the pandemic, really, and they're what inspires me to come to work. I think they are the true heroes of the COVID pandemic, the ones that were at the bedside taking care of the patients and still are. Obviously, we were planning for special precautions for our staff. It's called PPE, or personal protective equipment. Had to make sure we had enough of that the staff knew what to do. We actually had our plant engineering set up special negative pressure rooms to make sure the virus wouldn't spread outside of the areas that were designated. So there was everything from engineering to employee health screening, and finally, of course, vaccination, which is a hope on the horizon.
We were proactive and we set up like a team of clinicians to see from different perspectives, from pharmacy, from medication, from a provider side. So we were able to come up with a treatment guideline for MGH, and then also with the help of the IT department, we were able to make those treatment guidelines live as quickly as possible.
So one of our main goals at the hospital is for us to continue to be focused on patient-centered care as well as affordable health care. And we are able to accomplish that through the teamwork that we see throughout our employees to be able to assist with getting individuals back to the best quality of health that they can have.
You know, it's nurses, it's therapists, it's our PAC team itself, our families, and the leadership. I think it's just amazing how everybody's just pulled for each other, and I think that's been truly, truly wonderful to see.
We've had very good success with the vaccination, and our rates of COVID have gone way down since we started vaccination. That's what I'm most excited about, the fact that, I was reporting 44 cases a day, and now I'm reporting maybe 1 or 2 cases a day. And it's really helping us stomp out COVID.
And I've taken the vaccine myself, and the side effects were mild. I actually had COVID myself back in November. And so my plea to people would be, if I find it safe enough to take it myself and give it to my family when it's due, then I think it's safe for everybody else to take it. And the science is there. It's a safe vaccine. It's literally the most important thing we can do to stop this pandemic. And so I would urge everybody to take it.
Marion General Hospital is committed to taking care of our community throughout this pandemic and well into the future. Get vaccinated when it's your turn, and we'll all be able to get through this pandemic together.